Good evening, everyone. Good evening to all my seniors, colleagues, friends, and juniors. I'm very thankful to the Global Raj Medicon 2026 team for granting me this opportunity to present in front of all of you the topic Artificial Intelligence, that is AI Trends in Pharmacology. Without any delay, let's get on to the topic. Artificial intelligence is everywhere today, from phones to finance, from art to automobiles. But in medicine, especially in the subject pharmacology, AI is just not a trend. It is a quiet revolution. Today we are going to talk about the following important points: how AI is already influencing pharmacology, what is real, what is exaggerated, how AI will shape the future of the medicines, drug safety, and learning. This is AI in pharmacology beyond the buzzwords. First of all, let us get to know why pharmacology needs AI. Pharmacology deals with complex molecules, multiple targets, unpredictable human responses, and enormous data sets. Traditionally, drug discovery takes 10 to 15 years. It costs billions of dollars, and most drug candidates, they fail. They do not pass the standards of the drug discovery process. AI enters pharmacology not to replace the scientist, but to handle and assist in the complexity, speed, and scale. The first trend that we're going to talk about is the AI in drug discovery. This is where the AI has highly influenced and made the biggest impact. Traditionally, scientists, they tested thousands of molecules in labs, one by one. What has happened with AI? Algorithms screen millions of compounds virtually. They can predict binding to the receptors, toxicity, stability, and bioavailability. AI is helping the scientists and all the clinicians to answer the question, which of the molecules are worth testing in real labs? How does this help? It saves time. It saves cost. It minimizes the unnecessary animal testing. So AI, in a summary or in a nutshell, it shortlists the candidates. It does not approve the drugs. This should be very, very clear in your minds. Now let's talk about the trend number 2, AI in predicting the toxicity of the drug and the drug safety. Now, many of the drugs, they fail, not because they don't work, but because they are unsafe. AI models are prepared, and how do they help us? They help us to predict the liver toxicity, cardiotoxicity, drug-to-drug interactions, and dose-related adverse effects. How does, in turn, it helps the clinicians and the pharmacologists? They can discard the unsafe and the toxic drugs earlier. They can design safer molecules. They can reduce and minimize the later stage failures. How is all this so important? This is very, very important in the drugs related to oncology, CNS drugs, and long-term therapies. So AI, in a nutshell, it is acting like an early warning system. Now let's talk about the third trend, AI in the clinical trials. Clinical trials, you all might be knowing, they are very expensive and they're quite slow. So how does AI help us? It identifies the real patient populations. It predicts who is more likely to respond to the drug. It can optimize the trial design. It can reduce the dropout rates. In another manner, AI can analyze electronic health medical records, Genetic data can be analyzed by AI. Imaging reports, they can be very well studied and analyzed by AI. How does this help the pharmacologist and the clinicians? The trials become faster, more ethical, more precise. But one thing you need to keep in your mind and never be confused and never have it as a myth. AI are simply assisting the trials. They are not replacing the human oversight or the ethics committee. This is a very important point, keep in your mind. Now let's talk about trend number 4. Use of AI in personalized medicine. Now you might have heard about the phrase tailor-made medicines. So here this phrase is applicable. And how it is applicable, let's get to know. AI is helping us to integrate genetics, age, gender, liver and kidney function, and also lifestyle factors. How does this help us? It allows the right drug selection, the right dose, and select the drugs with fewer side effects. Now this is very much in vogue and it is already much happening in cancer therapy, in psychiatry, in transplant medicine. For very common conditions like common cold, fever, headache, we don't use tailor-made medicine. Rather, one size fits for all. This particular phrase, it works in the common ailments and this will always continue to. So don't be confused and have a clear, crystal mindset where we use AI only for the personalized medicines in the complex situations and severe conditions. Next trend we're going to talk about is the AI in pharmacovigilance. Once the drug reaches the market, you all know as being pharmacology students, the story is not over. AI now helps us to scan millions of adverse event reports. It can detect rare side effects very early. It can monitor the social media and the database. All this done by AI. It strengthens the post-marketing surveillance, the drug safety decisions. Timely warnings and withdrawals can also be done with the help of AI. And this all tasks performed by AI, they are very, very crucial to prevent delayed harm and large-scale safety issues. Now let's talk about the next trend, how the AI is used in pharmacology education. For students and teachers, AI is changing the whole scenario how we learn. AI tools, they help in adaptive learning, personalized quizzes can be made, concept visualizations can be done, and revisions and plannings, they are also assisted with the help of AI in the teaching. But you should keep this as a warning in your mind. AI should support learning. It should not replace the thinking. The creativity and the thinking of the teachers and the students should never be resisted, should never be in a box. And it should be freely flowing and shaping the scenarios of education in a better, positive manner. So you should keep one sentence in mind. Memorization without understanding is very, very dangerous. It can be with or without AI. So you have to understand and memorize. Now lastly, I just want to throw some light upon this point. Will we have medicines designed entirely by AI? The honest answer to this particular question will be AI will be designing, humans will be deciding. There's a difference in designing and deciding. The final approval will be by the humans. AI can accelerate discovery, it can reduce failures, it can improve safety, but ethics, clinical judgment, patient care, these are the human responsibilities which can never ever be replaced by AI. So pharmacology is a subject. It is very, very much about the balance. The balance between the benefit and the risk, the efficacy and the safety. AI is not changing this philosophy. AI is simply helping us, assisting us by giving better tools. If we can use AI wisely, we can make safer medicines, smarter medicines, and more humane medicines. That is the work of AI. I hope you found this video useful and it was up to the mark, and I did justice to the topic AI trends in pharmacology. Thank you very much.